What would you do if a stroke hit you while you were home alone? No one nearby, no one to call for help. In just 40 seconds, a blocked blood vessel in your brain can silence your speech, freeze your movement, or stop your breathing. Over 13 million Americans over 60 live alone. Thousands never survive a brain aneurysm or hemorrhagic stroke simply because no one was there to act. Do you know that stroke symptoms can show up while you're making your morning coffee? A drooping face, a limp arm, words stuck inside your throat. And 1 minute of hesitation can mean the difference between recovery or lifelong paralysis. So if this happened today, would you know what to do?
This isn't just theory. This happened to someone, alone, afraid, and almost too late. Marsha was 72. She lived alone in Florida, hours away from her closest family. It was a quiet morning. She had just watered her plants and stepped into the kitchen, ready to FaceTime her grandson. But as she reached for her phone, the right side of her face suddenly sagged. Her arm dropped, her voice vanished. No pain, no panic, just a strange sinking feeling, like someone flipped a switch and shut down half her body. No one was there. No one knew. She tried to reach the table, but collapsed, face down on the cold floor. She couldn't scream. She couldn't call. Only the ticking clock and a terrifying silence. But Marsha had seen a video just like this one. With the one hand she could still move, she pressed and held her phone's power button. She whispered the word stroke. 17 minutes later, help arrived. Doctors said if she had waited just 10 more minutes, the part of her brain controlling speech would have been permanently damaged. So if you were Marsha, would you know how to save yourself? Let's go through the 5 steps that could make the difference between life and death.
Number 5. Recognize the symptoms immediately. Your brain is sending an SOS. The first and most crucial step to surviving a stroke alone is recognizing that you're having one. This is harder than you think. A stroke can muddle your thinking, and denial is a common first response. Your brain might try to explain away the symptoms as something less serious. As one viewer shared, they had a stroke at home, didn't recognize it, and just went to bed. A delay that could have cost precious brain cells. The medical community uses the acronym FAST to help identify a stroke. When you're alone, you need to perform these checks on yourself. Face. Look in a mirror or use your phone's camera. Try to smile. Does one side of your face droop? Arm. Raise both arms in front of you, close your eyes, and try to hold them steady for 5 seconds. Does one arm drift downward? Speech. Say a simple sentence aloud, like, "The sky is blue today." Are your words slurred or jumbled? Can you form the sentence correctly? One viewer shared the heartbreaking story of her aunt who couldn't say a specific number she was reading, a missed warning sign. Another survivor recounted how they couldn't articulate a complete sentence, even forgetting the word stroke. Time. If you notice any of these symptoms, time is critical. Every minute counts. Beyond FAST, watch for these other warning signs. Many survivors have shared experiencing these. Sudden numbness or weakness, especially on one side of the body, like waking up with half your body feeling numb, as one viewer described, or one side of the body being numb from the forehead down, as in a TIA. Sudden confusion or difficulty understanding. Sudden vision problems in one or both eyes. One viewer lost vision in one eye. Sudden dizziness, loss of balance, or problems with coordination. Sudden severe headache with no known cause. One survivor shared their only symptom was severe pain in the middle of their head. Another thought it was a bad migraine. Difficulty sticking your tongue out straight. The difference between recognizing these symptoms and dismissing them can determine whether you get help in time. Don't wait to see if symptoms improve. Strokes rarely resolve on their own without treatment, and delaying action only increases brain damage. If you have any doubt, act. Number 4. Call emergency services immediately. This is your lifeline. Once you recognize the symptoms of a stroke, your absolute top priority is to get emergency medical help as quickly as possible. This step sounds obvious, but it becomes incredibly complicated when you're experiencing a stroke. Call 911 in the U.S. immediately, even if your speech is affected. Dispatchers are trained to recognize stroke symptoms. Say stroke if you can, but even if you can't speak clearly, stay on the line. Many emergency systems can track your location if you can't communicate. If you can't reach your phone or dial, use voice commands on your smartphone. Hey Siri, call 911, or OK Google, call 911. This is very important, as some survivors found they couldn't type or dial. Press emergency buttons on your smartphone, rapidly pressing the power button multiple times on many devices. Call 911 even if it seems like your battery is dead. Always keep your phone charged. Use medical alert devices if you have them, like Life Alert. Use smart speakers if available. Alexa, call for help. Bang on walls or floors if you live in an apartment or adjoining house. When connected with emergency services, communicate as clearly as possible. Say that you think you're having a stroke, provide your location, and mention if your door is locked. Emergency personnel may need to break it down. Describe your symptoms and when they started. Hospital choice is very important for stroke treatment outcomes. If possible, request to be transported to a designated stroke center. These specialized facilities have specific protocols and equipment to treat strokes quickly. Some ambulance services may bypass closer hospitals to reach stroke centers if the situation warrants it.
Number 3. Position yourself safely while waiting. Protect yourself from further harm. How you position yourself while waiting for emergency services can affect your condition. The goal is to minimize complications and prevent further injury. Many viewers expressed concern about being able to do much during a stroke, and that's valid. Only do what you can safely manage after you've called for help. Lie on your side. If you're feeling weak or dizzy, common stroke symptoms, lie on your side instead of standing or sitting. This reduces the risk of falling and further injury. The recovery position, lying on your side with your top leg bent, bottom arm supporting your head, is ideal because it helps keep your airway clear. Keep your head slightly elevated if possible. A small pillow or cushion can help. This may reduce pressure in the brain for some types of strokes. A great tip: if possible, lie in a place where family or friends wouldn't expect to find you if they came looking, such as on the hallway floor instead of a bed or sofa. This immediately signals that something is wrong. Avoid eating or drinking anything while waiting. A stroke can affect your ability to swallow correctly, creating a choking hazard. Also, some stroke treatments cannot be administered if you've recently eaten. Remove constricting items. Loosen tight collars, belts, or anything around your neck, chest, or waist that could affect your breathing or blood circulation. Also, as one viewer very rightly advised, remove dentures to avoid a choking hazard. Try to stay warm without overheating. A stroke can affect your body's ability to regulate temperature. Remain as calm as possible. We know this is easier said than done, but stress and panic can raise your blood pressure and potentially worsen stroke damage. Focus on breathing slowly and steadily.
Number 2. Make yourself accessible and prepare for help. Saved seconds are saved brain cells. After calling emergency services, if you're able, your next task is to ensure help can reach you quickly and efficiently. This step is often overlooked in the panic, but can prevent critical delays. Again, only do these things if you are able, and it does not delay your call for help or put you at further risk. Unlock your door if possible. Emergency personnel may need to break down a locked door, wasting precious minutes. If you live in a security building with multiple entry points, try to move towards the main entrance if you can do so safely. If you're in a remote area or somewhere not easily visible from the street, find ways to make your location obvious. Turn on outside lights, open blinds. Position yourself where first responders are likely to see you, near the front door or in a main room. Gather essential information from medical personnel, if possible. One viewer shared they finally wrote their medical information on a card to keep in their wallet, an excellent proactive step. If you can, gather a list of your current medications, your medical history, especially conditions like high blood pressure or previous strokes,
contact information for your doctor and emergency contacts. Create a safe environment while waiting, if possible. Clear a path to your location. Move furniture or objects that might block medical equipment. Some viewers found this suggesting difficult to implement during a stroke, so only if it's truly feasible and quick. Turn off stoves or potentially dangerous appliances if you notice symptoms while cooking. If you have pets, secure them in another room if possible to prevent them from interfering. These preparations may seem secondary, but they can significantly reduce delays in receiving treatment once help arrives.
Number 1. Document your symptoms and their progression. This information is gold for doctors. This is a step that one viewer said really shook them when they realized how critical this information could be. Documenting when your symptoms started and how they've changed can provide invaluable information to medical providers, especially if you can do this while waiting for help or immediately after noticing the first sign. The exact time your symptoms started is one of the most critical pieces of information doctors need. Some effective stroke treatments, like the clot-busting drug TPA or mechanical clot removal for ischemic strokes, must be administered within a specific time window from the onset of symptoms. If you can, note the exact time you first noticed symptoms. This information can determine your treatment options. How to document if writing is difficult. Use your phone to record a voice memo detailing the time symptoms began, what you experienced first, how they've progressed or changed, any actions you've taken or medications. If your condition allows and you are lucid enough, set an alarm on your phone to go off every few minutes. This can help prevent losing consciousness without anyone noticing and serves as a backup in case you can't call for help again. Beyond timing, pay attention to whether your symptoms are getting worse, staying the same, or rarely improving. This information about their progression helps doctors understand what's happening in your brain. Also note if you've taken any medications recently, especially blood thinners, pain relievers, or blood pressure medications. This affects treatment decisions at the hospital. The specific detail you document during this emergency can significantly impact your treatment plan when you arrive at a medical facility. Surviving a stroke alone doesn't end when emergency services arrive. What happens at the hospital and in the following weeks determines your long-term outcome. When you get to the hospital, stroke treatment focuses on restoring blood flow to your brain as quickly as possible. The recovery process continues long after the initial emergency. Physical therapy, speech therapy, and occupational therapy may be necessary. The brain has remarkable recovery capabilities, and with proper rehabilitation, many stroke survivors regain significant function. Miracles do happen, and recovery, no matter how difficult, is possible.
And now that you've learned the 5 steps to survive a stroke alone, don't let that knowledge go to waste. A stroke doesn't wait. It can hit when you're home alone, when you think it's just fatigue, a sore shoulder, or stress. But just 1 minute too late can take your ability to walk, speak, or survive. If you live alone or have aging parents or friends who do, please share this video now. You might be the only reason they survive. Don't say, "I'm fine." Prepare before it's too late. Print these 5 steps, tape them to your fridge, watch this again with your loved ones. It's not too late. You're not too old, but you must start today. If this video helped you, type "I'm ready" in the comments and share it with someone you care about.